My name is Jada. I am the founder of Boober and Birthday Presents. Boober is a platform where expectant parents and new families find all of their pregnancy to postpartum care providers, such as birth doulas, postpartum doulas, lactation consultants, and mental health therapists. We were known as a totally in-person company until COVID, and we have rapidly transformed into all virtual care for now. So please do know that you can reach out for virtual support. We'll be talking a little bit about what virtual support might look like, since I know a lot of people have questions about that. I also founded a company called Birthday Presents, which has been in New York City for 18 years, serving over 20,000 parents in childbirth education classes, breastfeeding, newborn care, CPR, and doula training. So that is a little bit about me, and I'm here to answer anything about pregnancy, birth, postpartum, lactation, all of it. So Michael, why don't you introduce yourself?
Hey everybody, I'm Michael Wieder. I'm one of the co-founders of Lalo. For those that don't know, Lalo is a modern baby and toddler brand, best known for our two hero products, our daily stroller, which is a full-size everyday stroller, and the chair, which is a 2-in-1 high chair play chair, meant to look good in your home, be easy to clean. And we launched in 2019. So been just over a year that we've been live for serving parents, and I'm a new dad. I have a 3.5-month-old named Gemma. So been riding the waves of newborn care along some of you, and here to help hopefully those expecting in the next few weeks feel good about what you're about to experience despite this crazy time.
Yeah, definitely. So we really want to hear kind of what is on all of your minds. You know, some of you submitted questions in advance, and we'll field a few of them, as many of them as we can. And then please just go ahead and ask us any of your questions as we still see people coming in. So I know that one of the questions, or let's just talk a little bit about, you know, what's going on with COVID and how it certainly has changed parenting, I think, in a lot of ways, right? As all of you who are preparing and you're thinking about, should we have family members come to visit us? What is safe? So several of you asked the question, can I have grandparents, you know, my parents or my partner's parents come and support? And I guess let's hear a little bit. Michael, you have a 15-week-old, you said? So
yeah, 15 weeks today.
Yeah.
So born just prior to the hysteria of COVID, and I think at that point no one was really thinking about COVID. So, but we were quickly, 4 or 5 weeks later, really staring it in the face. When I remember my first day back in the office, I sat down with my co-founder and was like, I think we need to all work from home. And this was like a week before the New York City shut down. So quickly then we honestly escaped outside the city to my family's house because our lease was actually coming due in our apartment. So we needed to find a place to be. So we have one set of grandparents that's been 100% present, helping with care, and so lucky and grateful for that. And we have another set of grandparents that, quite frankly, is missing this time with her. So, it's been on our mind, like, how do we see them? Do we see them? Do we introduce, like, FaceTime bath time is like the best time for them.
FaceTime bath time.
FaceTime bath time every night, and they're getting that. And we've slowly started now on Mother's Day, we welcome them into our COVID tribe because they've isolated for a long enough period of time. They didn't go outside, they didn't interact, or do anything in order to spend that time. But it was a while until we felt 100% comfortable doing that. But I think ultimately you just have to do what you feel comfortable with.
Yeah.
If you feel a sense, like an ounce of not feeling comfortable, don't do it. Like, it's okay not to step outside your comfort zone right now.
Definitely. And I think that's something, for all of you expectant and parents with new babies, we've heard from a lot of people reaching out to us that, they're getting a lot of pressure sometimes from grandparents or friends or close, other family members to come visit. And I think, like what you're saying, just this idea of, you have to draw those boundaries for yourself. And you are also often we're concerned about what's going to happen with the grandparents when they come, because we've just been in hospitals potentially. So those of you who are giving birth, who've gone out, right, you have to consider that you need to quarantine at home for 2 weeks really before we expose to, to grandparents who are of course the most vulnerable. And then also thinking about the grandparents, if they are going to come visit you, how are they going to do it? Will they rent a place nearby? and if they need to fly or drive to you, rent a place nearby, wait for 2 weeks, right? And then they can enter into your bubble and you can combine bubbles. So that's what some people are doing. A lot of people have questions about, can I hire overnight care, a postpartum doula or a baby nurse? You know, and I think that's something I would love to talk to everybody about, this idea of virtual care and whether that's helpful. Did you have, so how did you do with your baby? You had a first few weeks solo, or?
Yeah, we had the first few weeks, and we didn't have a baby nurse even during those first few weeks, but we were, you know, we had family visiting all the time. Our family just doesn't have boundaries. And we were okay with that. We told them, if we need boundaries, we'll let you know. So we were lucky during those first 4 weeks, and then we came up here. But I mean, virtual care has been important for us, especially breastfeeding. My wife has definitely, we're lucky that our pediatrician happens to be also a lactation consultant, but you're on my speed dial too, just in case you can't answer. And that's been really helpful to turn to virtual care in this time and just be able to shoot a quick message if something was going on. You know, but we did not have any overnight care, no postpartum doula at the time, no baby nurse. But my co-founder Greg, he actually gave birth. His wife gave birth during COVID in April, and his in-laws did exactly the thing you said. They came up. They live in Florida. They flew up. They quarantined for I think 2.5 weeks or 2 weeks in New Jersey, waiting to see the baby. And then once their time was up and tested negative, they came and saw the baby.
Yeah. So yeah, a lot of options for that. There's also, you know, people are doing, of course, which is definitely not as satisfying, but I've seen some really emotional videos where grandparents have come to the outside of the home and seen the baby through the window, which clearly in New York City, where we are, doesn't always work if you're on the 30th floor. You know, exactly. But it can be an option for some people.
I don't know if you saw this like hug shield that someone built. Did you see this?
No.
Like, built like arm sleeves. To,
oh yeah, in the backyard.
You're like basically a saran wrap hug. Very interesting. Yeah.
Very interesting. So you guys are all very clever. But, you know, in terms of, I want to talk a little bit about virtual care. Somebody just asked a question. Actually, let me read that question. At what point do you think there's value in getting a virtual lactation consultant? My baby is feeding and fine and gaining lots of weight, but I don't think my technique is necessarily the best. I'm just not sure whether someone will be able to help much virtually. So thank you for that question. And I love, you know, it's really is a time to go like, can this help? Can this not? I mean, if your baby is gaining weight well, that's really important, right? So if the baby's gaining weight, we know the baby is doing okay. If the baby's eliminating well and your pediatrician feels good about how your baby's been doing, then the question is, you know, can a virtual lactation visit make me more comfortable? Because, you know, especially for those of you expectant here, right, you have to breastfeed on average 8 to 15 times per day. It's an every 60 to 90 minute event sometimes in the early days. And, you know, it's very frequent. So if you're really uncomfortable still, and the person who asked the question, I don't know how old your baby is, so feel free to ask more questions about it. But, you know, I would say that a virtual visit can be really helpful. We have a lot of tips and tricks that we will suggest to you. You know, I always say, look, if you're struggling, if you're in pain, there's no reason to kind of keep doing that. For many of us, if we are in pain is usually a sign, you know, that the breastfeeding is not going as well as it could be. And pain will mean for many people that we won't make enough milk. It sounds like in your case, you are making enough milk and you just don't quite feel right. For you, I would actually recommend a level 1 lactation counselor. Like we at Boober, we have 2 levels. There's the level 2 lactation consultants that are the board certified, you know, lactation consultants. They're the highest level. They have 1,000 clinical hours of study. You don't necessarily need that, right? If you've got the hang of it, but you're kind of like, I'm sitting and I'm really uncomfortable. What can I do? Or it hurts just a little. We can make suggestions that are simple, but effective in ways that you might not have thought of. So a lactation counselor level 1, who is, you know, a more affordable price and can be a shorter visit, that might be a really great option for you. So you can always reach out to us. And, you know, when you do reach out to Boober, by the way, somebody real calls you back, you know, and you get a 10-minute phone call just to talk about it and kind of suss out and feel what feels right for you. So you don't have to commit to anything. You can kind of see like, should I do this? Or maybe the person on the phone will give you that one answer. That's all you needed.
Jada, I guess like my wife and I have had like, oh, this is going on, and I've urged her to like reach out, but there is sometimes a little bit of a hesitation. Like for those that are maybe a bit concerned that it's not going to be the same level of care, I guess, like, how have you guys seen an adjustment going from fully in person to virtual in the level of care or the results that you've been able to provide?
I mean, I'll be perfectly honest with you, because when I started Boober, I was 100% all in on in-person care. I feel like the value of in-person care is so great, and especially, of course, when we're dealing with, you know, a baby human that we need to adjust on a breast, and actually we normally get in there and we move things around and we touch the baby and all of that. I thought, I know there's a million virtual lactation companies that have been out there, but I just thought, for me, I'm really focused on the in-person care. When the pandemic happened and we had no choice, we very quickly, of course, got set up for virtual care. And what's been amazing is the feedback. I mean, people who come back and just go, we have so many feedbacks that say, I thought this wouldn't work. I was in enough pain or feeling uncomfortable or just needed a little extra help that I just decided to do it anyway. We still have amazing, high level scores of people just going, this is incredible. It's so helpful. So I was just telling you before, right? We had a customer the other day who I talked to who said, I literally reached out to you at 3 a.m. My husband said, why are you bothering? How are they going to help you? You're having physical pain. And the lactation consultant who, we have people who've been doing this work for so long, who are super expert. She was able to get the mom to shift the baby's position such that the woman literally was like, I don't understand, but I was not in pain anymore. So it's been really effective. For most things, there's a few things that do require an in-person follow-up for sure. And I think we'd be the first to kind of say, in this case, you're going to need a little bit higher level. Sometimes when there's a really complicated mouth, tongue tie sometimes, but you can even diagnose things like that and really give suggestions for that. So I would say when this is the thing to do, this is the thing to do. And don't, I always say if it hurts, get help. Like with breastfeeding specifically, it can hurt a little bit and then you'll be fine. Okay, fine. But if it hurts for more than 30 seconds, if you're doing the pain coping techniques you learned for labor and you're doing them while you're breastfeeding, if you are dreading nursing that baby and putting the baby back to breast, what's going to happen is you're not going to meet the laws of supply and demand. You'll stop putting your baby to the breast as frequently, and that's going to cause your milk supply to go down. And also, again, we're supposed to be doing this 8 to 15 times a day. If I am in deep pain, I'm just not going to want to do it. And the way breastfeeding really works, right, in our bodies is that every time the baby comes to my body, stimulates the nipple and the breast, and that sends a signal to my brain, which says, hey, make the milk making hormones, oxytocin and prolactin, and those come out, and then my body responds and it makes more milk. And so we really want to keep that feedback loop. So really, I would say a big thing to leave with today is if it hurts, definitely reach out for help and don't wait too long. Yeah, we had a question here from somebody who asked, is it safe to bring the infant to the park in New York City? Is it okay to sit in the park on your own blanket? So what we're hearing from all, pediatricians is that it is safe to go outside and it's okay to go outside, and it's probably helpful and healthful to go outside. We'll talk about that a little, as long as you can keep social distance, right? So that is really important. And depending on where you are, my personal feeling about New York City parks right now is that, from what I've heard, I have not personally been going into New York City parks because the reports on them and the pictures of them is that they're actually overcrowded in many places. So a New York City park might not be the choice unless it's pretty empty in that specific area, right? But you might need to sometimes just go on a walk, or sometimes find a corner of the park. There are places that you can find that are less crowded, and it also depends. One of the things I'm recommending to people is thinking about what time of day you go out. If you're feeling nervous about it, could you go out earlier in the day when less people are out, or later in the day when less people are out? And I think being not afraid as a new parent to really keep your social distance, walk far around people if you need to, put your hands out if somebody's coming, right? You just kind of have to. I think we all get it now. I don't know, Yeah. What do you think, Michael?
And I think, obviously continue to do the same precautions, wear a face covering, make sure you can actually social distance. You're not going to put a face covering on your infant,
right?
But, do what makes you feel comfortable. If if you feel comfortable in the park and you see that you can keep your proper distance, go for it. If you have that ounce of feeling uncomfortable, don't do it. Stay to your walk around the block, or walk a couple blocks and back. I think we're seeing, and we can tell because people tag us on Instagram when they're out with our stroller, but we're seeing that single walk around the block is such a reprieve right now for families to get outside, to see the sun, to get fresh air, and also for your baby to see certain things, to smell certain things, to hear certain things. That sensory development is still important for the baby. So if you can get outside, do it. We do see some people using our rain cover as a covering for the child. That is not necessary, but if it makes you feel more comfortable, go for it. And I, like I said before, it's like, this is not a time to step outside of a comfort zone. Find your comfort zone, whatever that is. And your comfort zone might be different than another friend. If another friend says they're not going into the park, that's their prerogative. You can do it if it feels right to you. There's no judgment here. You have, like everything else with COVID, you have to find your right lane that feels right to you.
And I think that actually links right into parenting. So many of you are not parents yet and will know, right? I mean, I know when I was pregnant, people told me, they walked up to me all the time and told me I had to have an epidural or I had not to have an epidural. And it was like, everybody was so random strangers, right? Telling me. And I remember pushing my daughter in her stroller one day. It was raining. I didn't put the rain cover on because it was warm out and we were a couple blocks from home, right? And I was like, whatever. This woman came, your baby's getting wet.
Yeah, I know.
It's cool, right? And it was one of those things, and I'd been, of course, in the field for so long that I was doing this work well before I had a baby. And so it was really interesting to finally be on the side of parents and be like, oh my God, all this unsolicited advice that just comes at you. And I think that is like becoming a parent, all the choices you all have to make for childbirth. Like, remember, like, you can come to our childbirth classes at Birthday Presents. We do all these childbirth classes, but we don't tell you which is the right thing to do. It's like, here are the choices and options. And I think that's the same with COVID, right? Is kind of learning what you can and doing the best to keep yourself feeling safe and protected. And I think one of the things that's interesting about the rain cover that you brought up, one of the pediatricians I interview in one of our webinars, I do work with her a lot. She said, look, the rain cover, absolutely, it's not required. But it does serve as a little bit of a layer of like, don't come close to my baby, right?
Yeah, and if you have a stroller in your hands or the baby's in a carrier, that's a signal to people, right? Like, people are typically alert in non-COVID times of babies and old people, right? Like, and I think that continues to be true. Like, those are the most sensitive populations of people, and that especially in COVID in this heightened time, like that's a trigger to people to step aside a little bit, give you your space, and hopefully there's a little less random strangers asking to touch your baby right now, which is probably a good thing.
Probably a good thing for sure. So one of another question came in, maybe more of a specific question is the note, but let's see. My baby has a tongue tie and the procedure to resolve is elective, so cannot be performed during COVID. My baby is feeding well, but it's painful for me. Do you have tips to suggest alternatives until COVID restrictions are lifted? Yeah, thank you. So just for those of you who are here who don't know what a tongue tie is, it is a what we call tethered oral tissue, or ankyloglossia is the formal term for it. But it's basically, I'll show you, I don't have a tongue tie. My tongue comes out very far. Babies with a tongue tie, the tongue is held by that frenulum. You have this little piece of tissue that is holding the tongue. And if the tongue can't come out of the baby's mouth, and sometimes when the baby cries, usually the tongue comes really far out. And with a baby where that tongue is restricted, it's held back into the mouth, almost looks heart-shaped, but it can be all sorts of different levels of restricted. So alternatives can be, there are several exercises that you can do with the baby's mouth. There are, you could virtually, potentially, we usually would recommend seeing a chiropractor. There's a couple, Rena, I don't know where you are located, but for instance, there is a chiropractor in my neighborhood in Park Slope called Flower of Life. They specialize in babies with tongue tie, and they would, sometimes it's the jaw is very tight in the baby. And even though there is a tie, if they can release the jaw and the tension and the muscles in the neck and the shoulders in a baby, it actually sometimes frees it up so that it can reduce pain. So you may be able to learn some of those techniques either by finding a local chiropractic if you are comfortable with going in person. And if you're not, people are doing virtual visits where they could potentially show you some of the stretching that might help. You know, you might need to have that intervention done. I know that there is somebody here who is seeing people in person. So there are a couple in New York City. So it's more about whether, and I don't know where you are again, but whether you're comfortable with that. But I would look into alternatives to tongue tie. Craniosacral therapy is another kind of alternative that can actually really help babies who are very, very tight and restricted. But of course, again, that's something that we might need to see in person. So I would look into those exercises and stretches. And or you could reach out to us, and you can certainly just reach out to us for referrals, you know, that aren't on the platform. We'd be happy to do that. So another question. So I'm due in July. What are your thoughts about allowing family that is maybe not unnecessarily going out, but is going to the grocery store, et cetera? Can they come visit the baby? Should we not allow family to hold the baby, but maybe visit from afar? Yeah, I think that's one of those, you know, we'll both answer that, right? That's one of those really.
Yeah. I mean, I would start off by asking yourself, would you allow that person into your house if you weren't pregnant and had a baby and you knew they were doing that? Like, how far are you willing to expand your tribe? Are they part of that tribe of yours that you're isolating with or being comfortable being around? You know, I think the visit from afar is certainly an option, right? Like if you can keep that social distance, it's a good option. I think it's important to recognize that it's going to be painful to certain people that have thought about holding a newborn grandchild or family member for, you know, since you got pregnant and had this vision of what that was going to be, and that's going to be delayed. Like, that is going to be painful to them. It may be painful to you as well. But you have to keep yourself healthy. You have to keep your baby healthy. And, you know, I think that is a good barometer for it. If as long as you can keep the distance, it's good. I personally, you know, wouldn't let someone into my house to see the baby if I wasn't confident that they were isolating.
Right. And I guess I would add to that too, like, could you talk to that family member and ask them for 2 weeks before they come, not to go to the grocery store, and ask them to instead do delivery? You know, there are different things. And again, everybody has their own different level of comfort. I'm probably a little more on the extreme side of things where I would not myself, but you know, you have to kind of figure that out for you. But that is one way to do it, right? So let's see. Have you heard of any incident of a grandparent being infected by a baby? I think that is probably extremely low risk. I have not personally heard that, and I think it probably is pretty low risk. The question really is that if you've gone and birthed in a hospital, if, you know, all of you were in a place where you were exposed to potential lots of people. Now, the good news is, and in all the webinars I've done with the OBGYNs, you know, the OBGYN I talk to a lot feels really like the labor floor is quite protected, actually. You know, and it does depend how many COVID patients have been seen, but they are isolating the COVID patients, and everybody's using proper PPE. And we have seen there's not been a lot of reports of people getting infected from going to the hospital actually to have the baby, but there still is that potential risk that you have been exposed because you've been out, even if you haven't been out before, right? So that's really the issue, is just that grandparents are the most vulnerable age. And so it's, again, for you to decide and for the grandparent to decide. And it probably is low risk, but we're always kind of talking at, here's the utmost level of precaution. And then it's not always, you know, that's not what everybody can or feels right about doing. So, all right, so we have a question. We are due in early July and trying to select a pediatrician. It makes sense that doctors are not meeting up with parents prior to the baby's arrival, but how much contact should we expect to have in advance of the birth? We're having a hard time getting past the front desk person. We're having a hard time finding a doctor that will commit to visiting the newborn in the hospital immediately. So we've been told that the hospital will see the baby, the pediatrician hospital will see the baby, and then we can bring to the offices. Yeah, and you're right, none of this feels ideal. Thank you for sharing. So I'll just tell you the standard procedure, and if you want to share, Bridget, I don't know where you live, but at least in New York City, you always get the pediatrician assigned to you at the hospital. It's extremely rare that you would ever have your personal pediatrician at that time. And I would say that, a lot of people do get to have one kind of preliminary inquiry with a pediatrician when they're interviewing. You can interview a pediatrician. Some do it some have an open forum where they have a night, and they might have virtual nights where you can meet the pediatricians, and some do one-on-one visits for you to interview them. But I would say, and a lot of them are not meeting people ahead of time. And then you just call when the baby's born. The first visit is in person. And it's really critical, actually. And I wanted to ask you, Michael, I think you could speak to this since you've had a baby during this time. What are your virtual visits been like?
Yeah. So I think first of all, on the hospital thing, you're 100% right. Like we went to an information session at our pediatrician like in December. And then we never met or spoke to our pediatrician until the baby was born, and we called him, we're like, we're ready for our appointment. And that was it. So, and the pediatrician in the hospital was amazing. Like, so great. Like, yeah, we didn't interview them before, but they practice, they all have the same degree, and, are all pediatricians, and they all know the same things. And, we felt like, oh my God, if we lived near where this guy's practices, we may have chosen him. He was so sweet and kind and thoughtful. In terms of virtual visits, our doctor's been really amazing. Our doctor is part of the NYU system, and they happen to have a really good and easy to use app that we can communicate with. And our doctor is responsive, like insanely responsive, responding within, maximum 12 hours. If we're, late at night for a non-urgent question, she's getting back to us before 9 a.m. The next day. We've only been to our first visit, and then our doctor only asked us to come back for our 2-month shots, our first round of vaccinations. And the other day we were actually thinking, like, oh, we haven't been in a while. Like, do we need to go? So we shot her a message, and she's like, no, you just need to get your 4-month shots and just stay on schedule with your vaccinations. And she was like, we're staying in upstate New York right now because our lease expired on us and we're kind of homeless. But she's like, you can go in upstate New York and just, to any pediatrician that you feel comfortable going to. You don't need to come back to Brooklyn to do it. And that was extremely comforting. How accessible she's been has been extremely comforting. So I think all the doctors have been really, really thoughtful. Our pediatrician's office, since the beginning of March, when we went for or this was in April, our 2-month, they were only seeing well visits. They weren't taking any sick children in the office. They were doing virtual, care for sick patients and things like that. So our practice was really, really on top of things. And the doctors, I think, are really enjoying, especially for these well visits, like, and simple questions, being able to do more virtual, because I'm sure they get inundated with people coming all the time for little small things that parents have a natural anxiety about, like we all do. And they're getting less of those visits, can answer them really quickly through a virtual visit or email or message. The other thing we've been doing, this is just silly, just to like know how our baby's pacing, is like every week or 2 weeks, we hop on the scale and do some subtraction. I think it's also a good tip for us how we're up, keeping up with our weight during COVID. But we just, find out where she's at, and we even like lay her down with some paper and mark her length. And then we just Google the CDC charts and try to calculate what percentile she's in. And she's in a normal range of percentiles. There's no fear. And I think our doctors like ease and not asking us to come in, you have to be here, like, has put us at ease, because if the doctor isn't saying we should come in, we're feeling less anxious about actually going in.
Totally. And I think that's a really good link in to talk a little bit more. Somebody asked if we could talk a little bit more about actual, infant care, since right now they don't feel safe or comfortable hiring helpers or nannies, which is a lot of people out there. So yeah, I think one of the things as you're kind of preparing, those of you who are expectant or if you are at home, is how do we weigh the baby and how often do we have to do it? And I think that's really cool to hear how you were doing it. A lot of parents are doing that. If you have your own scale, you stand on the scale and hold the baby, right? And then then you remove the baby and then you on the
Math.
scale, and you do the math and you figure out, which is perfectly fine for normal baby weight gain. Now, if there are issues in lactation and we're trying to figure out more specifically, and we need a little more clear or accurate, scale, some people are deciding to purchase scales ahead of time. The only thing I would say for those of you who do decide to purchase a scale ahead of time, if you decide to go that direction, I want to make sure that you don't overweigh your baby. There is actually a risk in really putting the baby on the scale all the time. They do not gain weight just like in perfect, order. Sometimes they feed more, sometimes they plateau, and it can really increase anxiety. So many of the pediatricians I'm working with have said, yeah, you can have the scale if you want, or you can use a pastry scale even. We've seen super cute pictures of babies in little bowls on pastry scales. And the only time you should actually really be using the scale is either with the pediatrician, or if the lactation consultant wants to do a weighted feed. That's one of the ways we know how much the baby is transferring their milk, is that we'll weigh the baby. You will weigh the baby if it's virtual, right before the feed. Then you would feed your baby, and then you will weigh the baby after the feed. And that's how you can see, oh, my baby actually took in, 2 ounces in that amount of time of feeding. Most people don't need that level of accuracy, actually. So, it's something we could think about, but don't overweigh unless you're doing something. It sounds great, like what Michael's doing, kind of giving yourself just a regular check-in.
Yeah, I think it's now even just because like we're 3.5 months. Today was 15 weeks, and we're like, oh, 15 weeks. Like this seems like a good time. We haven't done it in a couple weeks, in probably 3 or 4 weeks. So.
Yeah. So let's talk a little bit more. Other questions, about normal infant care is just, knowing that we're very commonly, we're watching pees and poops. Life is all about pees and poops for a while, right?
Yep.
So how much is going into the baby? If you're breastfeeding exclusively, you'll never know. If you're bottle feeding, of course, you will have a measure of what's going into the baby. But those of you who are exclusively breastfeeding, it's like, how do I know how much the baby has? So you really are counting pees and poops. And in the early days, we like the amount of pees to correlate to the days the baby is old, right? So for instance, on day 1, we want to see at least 1 pee in 24 hours. On day 3, it's at 3 pees. On day 6, it's 6 pees. Once you get to 6 pees, all of you, you're good.
Imagine if that was us.
Yeah, right. So yeah, you're just watching that. And that's one of the things, to think about. Another thing to think about is just knowing what's normal for newborns after. And I think that a lot of people have expectations of like normal newborn sleep, and they think that, a baby should maybe sleep longer than they do. So let's just talk a little bit about sleep here, and note that your baby in the beginning is going to wake up every 1 to 3 hours. That's perfectly normal, and it's healthy, and they have to do that, right? And babies don't sleep through the night for quite a long time, many, many months out. So if ever for a long time. I mean, that's, we don't even think about sleep training really before 12 weeks in most cases. So what we really want to think about in the very early days is the 4th trimester, right? Recreating that womb environment. Like, what can you do? Know that it's really normal for your baby to want to be held a lot. Like, I don't know if you found that. Did you find the baby wanted to?
No.
Yeah.
But no, she wasn't put down. It might be our fault, but anyway.
No, it's actually totally natural and normal. I think our culture has a little bit of a bent of like, oh my God, don't hold the baby too much, because if you do, it'll never learn to walk or something. And they will. Promise. But especially if you are in isolation, if you are by yourself, if you are not hiring somebody, I'm going to also highly encourage you to get some different baby wrap carriers. You really want to learn to wear your baby. And that is one of the things virtual postpartum doulas can do. We pop in through the screen, and like I just did a consult with somebody helping them figure out how to use their baby carrier properly. Virtual postpartum doulas are basically like normally in real life, in normal life, we would come over and we help people transition to parenthood, and we do whatever it is to help you feel more confident in taking care of your baby, right? So whereas a virtual postpartum doula, I can't hold your baby through the screen and while you take a nap. So that is something that we were very helpful with in the other days. During Corona times, what we can do is, let's say you wanted to book 4 hours of care, instead of me just coming over for 4 hours, right? I pop into your screen maybe at 9 o'clock in the morning for an hour, and then at 1 o'clock, and then I check in again at 3 o'clock and we do another hour, and then I check in at 6 o'clock when the baby's fussy, and we hang out together and we talk about soothing skills, and we, you know, I show you how to baby wear. You show me the diaper and you're like, is this normal, right? So the diapers help us kind of, as we talk about newborn care, help us kind of read what's going on with the baby. But baby wearing, it's just like what you're doing is you're basically helping the baby to be held. You're also giving yourselves hands-free time, right? And you're able to kind of go about your life while your baby feels like they are the closest that they could be in the womb on the outside. It's super for partners who can be really, you know, partners can wear the baby, and that helps them do a lot of the soothing and caring. So I highly recommend a woven like wrap carrier, but there's also structured carriers. And in our newborn care class or in our baby wearing class at Birthday Presents, you can check in and kind of learn more about that. You always, when you are wearing your baby, I just want to be really clear, your baby should always be at kissable height. I have to be able to kiss the baby's head, and I should see their airway so I can see that they're breathing. I might need to look in a mirror, or I can like see right there, but I want to make sure that my baby is not super tucked in this position. So you sometimes see people wearing their babies really low on their bodies, kind of like down in a deep bag or purse. That we don't want. We always want that baby up here, kissable height. So that's a little something we've got for you. Let me see some more questions over here. So somebody asked, when we return to work, how do we keep the milk supply going? Any recommendations? Yes, so we have a full-on milk supply building. We just did a class on that. So we're gonna have that actually at Boober, where you can find that and do our whole class on milk supply. But one of the tips basically when you are back at work is milk supply is all about what comes out gets remade, right? So more milk out means more milk made. And so you basically need to pump as many times as you would have fed during the day in order to keep your supply up. So that is important. And when you're working, if you're not working in the home and able to just, you know, because some of us are, more people than ever are working in the home, if you are leaving the home, then it's really making time to pump and express milk if you can. And even if you can't pump for as long as you thought you needed to, even getting 5 minutes in more frequently throughout your day is going to help your supply kind of stay up. So that's something to think about. We have a question here. Oh, yeah, sorry, go ahead.
I think there's a question about you keep being around your baby without a mask. Like, your baby's part of your tribe. You know, you do not need to wear a mask around your baby. That's not part of the guidance from pediatricians, but maybe Jada, if you want to.
Yeah, you don't have to, if you're at home, you know, with your baby, you do not need to wear a mask. The baby's fully exposed to you unless you are COVID positive. If you are COVID positive, or you think you're getting sick, if you're unsure and you do feel like COVID symptoms or any kind of symptoms, actually, because it might be COVID and we're not sure, are coming on, then you should definitely mask, and you're going to want to practice. Of course, you already are, but you want to practice that rigorous hand washing. You can breastfeed your baby and care for your baby if you are COVID positive and not super sick, but the droplets are the issue where it would pass to the baby, not through the breast milk. So the CDC and, you know, the WHO, everybody's recommending breastfeeding is fine as long as you are protecting your baby in that way. So if the kissable height is just really important in terms of the airway of the baby, that we're not, you know, blocking the airway in any way. So yeah. So we have a question here about somebody who's due in October, nervous about having a school-aged older children and a newborn. So many factors that scream risk in my mind. I know that's definitely a lot of stuff going on, but if there's no school, the horror of having to homeschool with a newborn will literally break me. Thank you for sharing. How are people getting support for help with managing newborn life and older children? That is, I hear you. That is a lot, absolutely. And I think, you know, one thing that we're seeing a lot of parents are doing is they're using the screen more. The kids who are older are getting a little more screen time than we might have liked, and they're giving themselves permission to do that because they just got to find their way through it. A good way to use the screen, rather than just throwing them in front of a TV show, is to get a grandparent on the screen or a caregiver. People are actually hiring nannies to entertain their children through the screen. You know, if you need to, you need to.
I think there's going to be an interesting look back in this time in the way that parents and guidance around screens will change for parents and with children. And obviously this is all personal preference still, but I think a lot of the fear around screen usage outside of anything visual or developmental was really about isolation in screens too. Like you need to develop social skills and you need to be, meeting people, and it should be limited for that too. And I'm only talking about that. But what this time has taught us that screens can be a connective force as well. And this new way of using screens and this new way for children to be seen using screens. Like children weren't using Zoom until COVID. And now they're sitting in class on Zoom.
My daughter and my 3 stepdaughters who are, I mean, it's crazy that we're all there in school, literally like on their computers nearby, and we're working. And look, I don't know how old your child is, probably a little younger because that feels more intense, but I'm the last person who's into screens. I'll just be honest. I'm like, I have a lot of struggle with, and I like to really clamp it down, but I also want to give parents permission right now just to do what they need to do to get through, so whatever.
I mean, we also think it's important that your child has their own space too. It will avoid them intruding in your space, especially if you have a newborn. Like, give them a space they feel really comfortable in and it's theirs. I mean, that's why we sped up the production of our newest product, which is the Play Table, which is coming out really soon. And there's a 1,000-person wait list for right now, but it's going to come out this summer, pre-sale opening in a couple weeks. And it's because of this. If school doesn't open up, camp isn't open this summer, we want to make sure kids have a place that's theirs, that they can play and explore and be their home office too. So I think that will help create that separation as best as possible, but it's going to be tough.
I think also just, having a few toys that you keep in the closet that you don't give, you give out, every few days, or you recycle things so that they have a new thing to engage with for a little while. As well. And then some people are having a nanny quarantine and then come into the home, that is what some people are doing as well. So somebody, let's see. So more just in terms of caring for the newborn, we have a couple more questions about that as we start to wind up. Advice on more newborn care and what can I do without family. So just remember, create your stations, do as much as you can while you're pregnant to kind of create the areas in your home that's going to make it easier for you. So if you're planning to breastfeed, give yourself a comfortable breastfeeding chair, have a footrest there, have your pillows, get the stuff ready that's going to make this nook comfortable for you. Start preparing food in advance that you can freeze. Know what foods or how you're going to order, or maybe even have enough for a month that if you don't have to go out the first month, that would be okay. Make sure that you, I think taking a newborn care class can really help to teach you kind of more of the basics about diapering and cord care, right? And how do I bathe my baby? So, somebody else asked about newborn care. Like, it's a fun learning process. YouTube is full of great videos too. We have a bunch of videos on our @GetBoober YouTube page, like, how do I swaddle a baby, right? Like those kind of questions, learning that in the 4th trimester. I really think that for all of you having babies right now, kind of just going with the baby, being really in touch with, okay, babies want to be held a lot. They want to be swaddled. They want to be soothed. They want to be bounced. Shh, right? You can shush them and rock them and feed them when they want to be fed. We do find that babies that are responded to really quickly cry a lot less than, so don't feel like, oh my God, I can't pick up the baby again. If you just pick up the baby, you'll find that they're happier. If they're having a meltdown because you put them in the crib or you put them down, pick them up, let them, they can sleep on your body when you're wearing them safely. You want to take naps when they're sleeping. Do you guys ever do that?
Yeah. I mean, especially, I think also there's also a question, and I don't know how people's parental leave is changing during this time. And for those, different for single parents and partnered parents. But if you are in a partner relationship and you're co-parenting with someone, I think you need to find your rhythm too. That's a lot. It took my wife and I some time to figure out what the right rhythm was for us, especially because I'm fully back at work, the founder of a business and a growing business, and how are we going to create that balance? And so for me, I take the baby in the morning, I push back the start of my day, and I give her an hour and a half in the morning to shower, to work out, to have alone time, to catch up on some of her work that she's starting to roll back into. And I think finding those balance, and, there's more moments like that throughout the day. We've now, now grandma, who's been here 100% of the time, it's not just watch her when you want and be a grandparent. She's also now almost acting as a nanny for us. And like, she has specific blocks where she's meant to watch the baby. So if you can do that with your partner, if you don't have that help, you don't have a nanny, a baby nurse, a grandparent with you, or family member, find a rhythm, be somewhat prescriptive about it, try to hold out, and like over communicate too with your partner. Like, more than ever, I think it will allow you to be comfortable at this time. And we didn't talk much about it, but you have to keep yourself sane. Like, mental health is a conversation for postpartum women, especially, like, regardless of COVID. And I think it's important that we're all looking out for ourselves. Like, yeah, like Jada said, like, if your baby's crying, pick them up. It will make you feel better. Like look out for yourself too. It's as much about looking out for your baby as it is looking out for yourself, and keeping yourself sane, keeping your partner sane, keeping each other sane.
Absolutely. Like, really, really important advice. And, we do have mental therapists, health therapists who specialize in pregnancy to postpartum if you need to reach out, but also know, like, if you have a therapist who you've talked to in the past, you can always reach out to them, or just talk to Zoom with your friends, talk to people who've been there. Like, just don't keep it inside. If you're feeling like, I am struggling, the quickest way to feel better is actually to talk to somebody and get help. We have a few more questions, and we're going to give you some codes now for Lalo. I think you have a code, Michael, yeah. And I have a couple codes for classes and Boober visits. And while you're typing that in, I'm just going to answer these other quick questions. I want to make sure I get to everybody's question. What's the best way to care for the umbilical cord? Usually actually just to keep it dry and let it fall off on its own 8 to 14 days, and just looking out for signs of infection. Green pus, yellow pus, really smelly, watching out for any, redness, a lot of redness around the belly button, or certainly the baby getting a fever. So after the umbilical cord falls off, you can then do a submersion bath before it falls off. You do want to do a sponge bath, and you can start tummy time from the beginning of their life, little bits of tummy time. Somebody asked that question, and does it interfere with the healing of the umbilical cord? Not really, but if it's particularly bothersome, then you can wait until it falls off. But you're also doing tummy time when the baby's kind of on you a lot, which we'll do.
That was a big learning for us. Like, our baby didn't love tummy time at the start, but then we learned, like, oh, she's getting tummy time because all the different ways she's holding herself up on us, or, in different positions. Like, traditional tummy time of putting them down isn't the only way they're getting that, developing those muscles.
Yeah, and somebody asked, should we wake the baby at night to feed, or do we just wait for the baby naturally to wake up? Wait for the baby naturally to wake up, unless you've been told that your baby needs to be woken up. But be mindful that a baby should not sleep definitely not past 5 hours in the early days, and more likely 4 to 5 hours. Your pediatrician will say by 4 to 5 hours, wake them up. As long as they can sleep 1 4 to 5 hour stretch per 24 hours, as long as every other time in those 24 hours, they are waking up every 1 to 3 hours and they're alert. A sign of a baby that's not getting enough is a baby that sleeps too much, being like 5, 6, 7 hours, and then they wake up kind of groggy. So looking out for that. And we have another question about what kind of support can birth doulas provide virtually, and postpartum doulas provide virtually. So birth doulas can really lead you through. We provide, emotional support, physical support. In virtual care is going to be done through the screen to your partner, if you have one, where we're going to text you lots of pictures, show you visuals, give suggestions on my own body that you can try. We find that a lot of the support is a lot more emotional and informational. So while some people are doing Zoom for their virtual birth doulas, and some part of it, we find a lot of people are just putting in earbuds, and then we're just talking and coaching through. And so we're hearing what's happening in the room. You're able to ask questions, and then we just talk to you and kind of keep you calm and answer any questions. So it can go in all different directions, but I think the virtual support has been really helpful, albeit different. And, somebody else asked out there, Are we seeing people around the country, out of state for virtual postpartum care and lactation? Yes, absolutely. That's been one of the interesting sides of this whole thing, is that we now can talk to people and help people wherever they are. So you asked me how long we would be virtual. We're definitely keeping the virtual component. It won't go away. Now that we've learned it and seen its effect, and there's something interesting on my screen popping up. All right, so let me just see if there's, I think we almost got everybody's questions. If the baby's having a hard time sleeping, should you let them cry it out? I'll answer mine, you can answer yours. I say that cry it out is something that you have to personally decide that you are okay with, and it is not recommended before 12 weeks. That is what I will say. And I am a person who believes that, you know, using a gentler method may be supportive, but cry it out. I know plenty of people who have done that and it's worked for them as well, as long as they're being mindful about doing it and being present and making sure the baby is not sick or throwing up from crying too much. There's a lot that can happen with it. We're actually doing a sleep class for through Boober. So if you're interested, a 0 to 4 months to ask all your questions about sleep. You know, sleeping takes so many forms. You can have the baby near you, you can co-sleep, you can sleep, you know, later with a baby in a crib. Michael, do you want to, maybe we'll end today on sleep?
I think this is a personal preference thing, 100%. We co-sleep, which I think a lot of people feel guilty about or don't think it's right, or because the pediatrician isn't recommended, they're a little afraid of it. I think for those that are expecting and those that are parents, you might recognize very quickly that a lot more people co-sleep than you imagine, especially all over the world. And this is like happening for, you know, centuries, basically, co-sleeping. So you can do it safely. I think if you're not comfortable with it, that's totally fine too. And find the method that's right. What we find in co-sleeping, and this is just personal experience, this is not a recommendation or a suggestion, is that because she's near us, she can smell us, see us, and she knows we're there. So the second she wakes up, like, she does not have a fit. We don't have any moment where cry it out is even an option, because as soon as she gets in a fussy mood, we're right there. We can handle it right away. Also, it's hard to let a baby cry it out when they're inches away from you. So, but she can be right on my wife's breast, like, very quickly, nursing in the night if she needs something. And even times, like, she'll find her way to the breast, like, naturally, and like just like scoot up in, and then, like, you know, my wife is now sleeping while the baby's breastfeeding. And I have to say it's been a really, really beneficial for us for our sleep.
Yeah. Thank you for sharing your personal story. Somebody just did text in about the safety of bed sharing versus co-sleeping. And I just want to be clear that, you know, Michael is sharing his personal experience with everybody, and you can talk to your pediatrician to figure out what feels best and safest. What the American Academy of Pediatrics will recommend is to get a co-sleeper, which is going to be a 3-sided kind of crib or bassinet that extends your bed out, or a bassinet right next to the bed that you can reach into. Most people find a crib is really difficult. It's too deep in the beginning, great later, but when you have this brand newborn. So just know that the recommendation of the American Academy of Pediatrics is to sleep in the same room as your baby now for 6 months at least, which does allow you to be right there, to be really responsive to your baby. And we do find that parents get the most sleep when they're sleeping near their babies, believe it or not, because they're able to respond when the baby first wakes up. And they also, especially birthing parents, sleep in the same cycle as their babies, which is interesting. And somebody also did ask a question about, you know, last question, I think, and then we should let everybody go. We're a little bit over. A question from a parent of twins with caring for the newborn on their own. So I just want to shout out to you, David, that's intense, right? And if there are 2 of you, you may find working on, if you're planning to breastfeed, tandem nursing, which is where you nurse both babies at the same time, can buy you some time. If you're using a bottle or doing both, and a lot of people, of course, do a blend of feeding different ways, then you can help with the bottle and feeding the baby while one is being breastfed and one is getting the bottle. That's one option. Trying to get the babies, some people like to try to get the babies to sleep at the same time, because otherwise we are on an endless cycle. Because normally we say, you know, follow the baby's lead in the beginning. but the babies may be a little bit on different cycles. So you may need to team up and, as the babies get older, but I would encourage you to check in at least with a postpartum virtual doula for a little extra support, or maybe just do a prenatal check-in visit to kind of prepare. I do a preparing for postpartum class, which is good for twins or singletons, kind of trying to figure out what are my needs and how am I going to do it. Baby wear, baby wear, baby wear. I think that's going to, you can be holding one twin while wearing, and then, being a little more interactive with the other at the time and switching off. That's another
problem. Or find a device or, a product that you can put them down in and they feel safe and comfortable in as well. There are definitely some good things out there. Once they are sitting up and holding their head up on their own, you can definitely start using a high chair as a place to park the kids too, to get your hands free, as another method to just like have them near you, have you at your height, whatever.
And I think this kind of goes for everybody here. If you are solo, having a place to safely put your baby down, if you just need a breather, your baby will be safe in that, in a flat, sleeper, right? You have a bassinet, like a flat bassinet sleeper, right? So babies can sleep in the bassinet of a stroller if it's flat. And so, wherever you can, put your baby down and give yourself that little breather if you need it. And please don't hesitate to reach out. We are here for you. It was great to meet you all.
Nice to meet you all. Thanks for your questions.
Yeah,
and
thank you so much.
Jada and I both put codes in the chat, so definitely.
Yeah, and I think we'll follow up. We'll sit with a little email for all of you. So thank you again so much. Take care.
Bye, guys.